all are fine. Kindly take care of your family and yourself in this critical time. And for your convenience, university recommended us to take your online classes. Be punctual, be regular, be responsible, and take care of your classes. Your teachers hardworking for you, and it is your responsibility also to take your responsibility. Today I would like to deliver first online lecture for you. First of all, I would like to repeat the lecture which we are covered in our classes. I think so many days are gone, and it's good if we revise the lecture and start again. First of all, I would like to talk to you that on the book, the page number is 446. The book is Fundamental of Nursing, BSc Nursing, that is published by Lotus Publisher and written by Miss Francis and Mishra. Okay, the chapter number is 13, Meeting Needs of Perioperative Patient. I think in the previous lecture in your college, you understand very well, but it's my responsibility to teach you in the depth so that you can understand very well, because the fundamental of nursing is very important for your whole life, because it's the basic building block of nursing. First of all, I would like to talk about you that when the patient come to the hospital, that time he or she don't know what happened with him or her. When we diagnose the person on the behalf of signs and symptoms and on the behalf of investigations done according to the order of the doctor in the laboratory, and according to that, if surgery is recommended by the surgeon, by the doctor, then we have lots of responsibility on our shoulder as a member of nursing profession. That's why I'll teach you the basic of perioperative nursing. First of all, I would like to talk with you about the classification of surgical procedures. Surgical procedures divided into various numbers and various types according to the problem related to which organ, the age of the person, and the lifestyle or hereditary history of the person. It is divided into three kinds. The classification of surgical procedure divided into three types. First is according to purpose, second is according to urgency, and third is according to degree of risk. I think you understand something from the name of the surgery. In case of according to purpose, there is some purpose behind the surgery, like diagnostic. Some surgery done to diagnose the exact cause, what happened with the patient and how it recovered. For example, in diagnostic surgery, we can talk about the biopsy, we can talk about the angiography. These kind of surgery, basically it's an invasive procedure, and it give us opinion, give us the exact diagnosis of the patient. Then palliative surgery done to relieve or reduce the disease symptoms of the patient, for example the colostomy. Then ablative surgery is operation diseased body part is removed. Sometimes person suffering from some diseases, and he or she suffer from any diseases related to any organ, for example gallbladder. Some person may be suffering from the gallbladder pain because of the reason behind maybe the stones develop in the gallbladder. That time these kind of surgeries arranged so that patient feel relief, and it's called ablative surgery. Then next is constructive surgery. As I belong to nursing profession, especially in child health nursing, and sometimes the child child born with some chromosomal abnormalities. And when the surgeon removes the chromosomal abnormalities to give the normal life of the child, that is known as constructive surgery. For example, the child born with lip problem, for example, it's known as cleft lip. Cleft lip, when the surgeon recovers the cleft lip, that time it's known as constructive surgery, because cleft lip is a chromosomal abnormality in the child have not seen. Then reconstructive surgery. It's known as reconstructive surgery because sometimes some function is not properly work in the child, in the patient. To improve that function, that time the surgeon performed the surgery. It's similar like constructive surgery or reconstructive surgery. In both cases, you can write the example of cleft lip or cleft palate. Then next is transplant. Sometimes patient need to transplant, that is, for example, hip replacement. Operation is performed to replace the malfunctioning of the organ. Might be due to the accident, the malfunction occur, or maybe the baby born with the hip dislocation. In these kind of surgeries, it's known as according to purpose, specific purpose behind the surgery. Then next is according to urgency. Urgency means might be there is emergency, might be there is only few hours with us to improve the conditions of the patient. And in this it is divided into two categories. First one is emergency. It's also divided into two types. First one is immediate and second one is urgency. Immediate surgery. For example, someone go to the outside from the home and he suffer from or he meet with the accident. In that case, might be he needed immediate surgery. And in urgency, might be we have some hours with us like 12 hours, 20 hours, 24 hours, and in this time we can recover the patient with the help of surgery. Then first one is emergency. Emergency divided into two. First one is immediate and second one is urgent. Then the next is elective. The patients need the surgery, but that is usually performed at a mutual consent of the surgeon and patient. Okay. Elective surgery actually is a planned surgery. The patient needs surgery, but without the consent of the patient, without the consent of the guardian, the surgeon do not perform the surgery. But the surgeon can perform the surgery in the case of immediate surgery or in urgency, right? But consent is very necessary in every kind of surgery. Fine. The third one is according to degree of risk. The person, sometimes the patient might be lost their functioning due to the degree of the risk. First one is, it is divided also in two kinds. First one is major surgery or the second one is minor surgery. Major surgery might be in diagnostic surgery in case of according to purpose, that in diagnostic surgery the angiography is performed by the doctor. In that angiography we can find that the coronary arteries of the heart is blocked. That is why need major surgery, that is bypass surgery. Okay, then the minor surgery. Minor surgery, it involves low degree of risk and produces few complications. For example, breast biopsy is the minor kind of surgery. I hope you clear of the surgery. For example, today we have learned about the classification of the surgical procedure. First one is, it's divided into three subclasses according to purpose, according to urgency, according to degree of risk. And according to purpose divided into next 6 category according to diagnostic, palliative, ablative surgery, constructive surgery, reconstructive surgery, and transplant surgery. According to urgency, divided into two. First one is urgency, second one is elective. Emergency divided into two. Immediate surgery, need immediate surgery or need urgency. Then the third one is according to degree of risk. According to degree of risk, surgery is divided into two: major surgery or minor surgery. I hope you clear this lecture. If you have any problem regarding any term, regarding any topic, regarding if you do not understand anything, then you can comment below the video. I can try to resolve your problem, or I can personally talk with you to take care of this issue. I hope you clear this. Stay blessed, stay at home, stay safe, take care of your family. This is the critical period, but it's your responsibility